You've ordered the invitations, you've picked out your dream dress, but there's one very important item on your wedding to-do list that you don't want to forget, and that's the premarital exam with your doctor.
So joining us now is Dr. Kim Cox with the Pocatello Women's Health Clinic with some advice about this important exam. Dr. Cox, thank you for joining us.
Glad to be here, Libby.
Now, it's called a premarital exam, but I'm guessing that this is an exam that any woman who maybe is thinking about becoming sexually active should have.
Establishing a long-term relationship, becoming sexually active, maybe even becoming pregnant, kind of depends on where their goals are. But you know, you want to get the appointment about 2 or 3 months in advance so that when the big days arrive, you have a chance to get on any form of contraception successfully that you're considering.
Okay, so something you want to plan early, and in some of the materials I was reading, don't think that you can get in right that 2 to 3 months beforehand, that you need to call at least a month before that even.
Call about a month ahead, and that will give you plenty of time for your doctor to coordinate with your menstrual cycle and get started on contraception.
Okay.
Now, when a person goes in for an exam, what is some of the homework they need to do ahead of time? What are some questions they need to bring to this exam?
Well, sort of what we reviewed last week when we were talking about different kinds of contraception. It would be helpful. There's lots of reading material, lots of information on the internet about different kinds of contraception. And if they could get a general idea about what their goals are, how long before they intend to have children, how long they want to delay their childbearing, any medical complications related to the medications, then that will help us come to a relatively quick idea about what they need to do.
Okay. What can someone expect as they're going into an exam like this?
Well, they can expect a fairly relaxing, unpressured exam. A discussion about medical history, a very open discussion about what their questions are, a physical exam to identify any medical or physical issues that may impact the initiation of their relationship, some education, maybe even a little anatomy lesson, and some educational materials so that they can, you know, everybody thinks they're a pro at sexuality, but lots of times both people
they don't know what they're doing at all.
Right. And so getting some real information so that both parties can learn what to anticipate and works for the other party will help them develop a long-term, mutually successful and satisfactory relationship.
Okay.
Going into an exam in a situation like this might be a little daunting. Is it one of these places where everything is, I don't know, on the table, but there's really no question you can't ask?
Absolutely none. Absolutely none. And many young women have a lot of fear about that first exam if it's their first exam. And we take our time, we explain everything that we're doing. We talk to them about how to be comfortable, because it does not need to be an uncomfortable, either physically or emotionally exam.
And I think that's really very true. I was so scared to have my first premarital exam, so it was difficult. Now, one of the things also that they should be aware of is if they have questions later, it's okay to come back.
Well, yeah, especially, first of all, you're introducing lots of times new medications like contraceptives, but separately, you're developing an entirely new relationship, and as that relationship develops, there may develop some issues, and it's very important to intervene on those issues before they become more well established, and maybe create some emotional relationship issues.
Because that can affect the relationship.
Yeah.
Absolutely, hugely.
All right.
Very good.
And if somebody would like to maybe schedule a premarital exam, can they call your clinic?
Yes, and they should know that we both have female providers and male providers, so whatever they're most comfortable with, especially young females that haven't been sexually active yet, lots of times are more comfortable with a female.
Very good.
All right,
Dr. Cox, thank you
so
very much.